Unlocking Diabetes, a complete guide for you to better understand your health. Hey everyone, tuned into Health and Wellness. Today we're going to have a straight and simple talk about a topic that affects many people's lives: diabetes. You know that whole high blood sugar thing? Well, that's more or less where our conversation starts. But don't worry, knowledge is power, and understanding what diabetes is, its types, and how to deal with it is the first step towards a calmer and healthier life. We often hear about it, but we don't stop to think about what it really means. Diabetes mellitus, the full name for this condition, is basically when our body has trouble controlling blood sugar, glucose levels, causing them to get higher than they should. And why is blood sugar so important? Because glucose is the main source of energy for our body's cells. If it can't get into the cells or builds up too much in the bloodstream, that's when problems begin. Type 1. Diabetes. When the body attacks itself. Let's start by understanding Type 1 diabetes. Just imagine, your body has an incredible defense system, antibodies, that fight off invaders like viruses and bacteria. In Type 1 diabetes, a sort of short circuit happens in this system. Due to what doctors call an autoimmune reaction, the defense system starts attacking and destroying the cells in the pancreas responsible for producing a super important hormone, insulin. The pancreas, this gland tucked away near the stomach, is the main producer of insulin. And what's insulin's role? It acts like a key, opening the door of the cells so that glucose, the sugar from food, can enter and be used as energy. When the pancreas of a person with Type 1 diabetes stops working properly and doesn't produce enough insulin, or any insulin at all, glucose can't get into the cells. The result? It builds up in the blood, causing that high blood sugar. It's like having a lot of fuel available, but the machines, the cells, can't use it. And how is it treated? Since the problem is the lack of insulin, the main treatment involves insulin injections every day, several times a day, or the use of an insulin pump, which is a small device that delivers the hormone continuously. In addition, a well-guided diet is essential. It's not that the person can't eat anything, but they need to learn to balance what they eat with the insulin dose they take, always monitoring their blood sugar levels. It's a constant learning process, but it makes all the difference. Many people ask, is there a cure for Type 1 diabetes? Unfortunately, for now, the answer is no. But hold on. Medicine has evolved tremendously in recent years. Today, with available treatments, people with Type 1 diabetes can lead normal, active, and fulfilling lives. The secret lies in strict control, discipline with medication, diet, and physical activity. It's a team effort between the patient, doctors, nutritionists, and the entire support network. Type 2 diabetes, the resistance that complicates life. Now, let's talk about Type 2 diabetes, which is the most common type in the population. Here, the story is a bit different. In Type 2 diabetes, the pancreas does produce insulin, sometimes even in large amounts initially. The problem is that the body develops resistance to the action of this insulin. It's as if the key, insulin, is there, but the lock, in the cells, is rusty or faulty, making it difficult for glucose to enter. The body tries to compensate by producing more and more insulin, but over time, the pancreas can get tired and decrease production. And what causes this insulin resistance? One of the main culprits here is abdominal fat, that belly bulge many people struggle to lose. Excess weight, especially fat concentrated in the abdominal area, is directly linked to this difficulty the body has in using insulin efficiently. In addition, factors such as a sedentary lifestyle, an inadequate diet, rich in sugars, unhealthy fats, and processed foods, a family history of diabetes, and older age also increase the risk of developing Type 2 diabetes. The treatment for Type 2 diabetes begins with a radical lifestyle change. Dietary re-education is the first step. It's not about starving, but about learning to make smarter choices. More fruits, vegetables, legumes, whole grains, lean proteins, and less sugar. fried foods, and processed items. Losing weight, for those who are overweight, helps immensely in improving the body's sensitivity to insulin. Along with diet, regular physical activity is another crucial piece of this puzzle. Moving your body not only helps burn calories and control weight, but also makes your muscles use more glucose, helping to lower blood sugar levels. It can be a walk, a light jog, swimming, dancing, anything that you enjoy and keeps you active. In many cases, diet and exercise alone can control type 2 diabetes. However, if these measures aren't enough, the doctor may prescribe oral medications that help the body use insulin better or produce more, or even injectable insulin in more advanced stages of the disease. And what about a cure for type 2 diabetes? Like type 1, we can't talk about a definitive cure. However, the good news is that with lifestyle changes, and if necessary, the right medication, it's possible to achieve normalization of glucose levels. This means the person can live very well, with their blood sugar controlled, avoiding the long-term complications that diabetes can bring, such as problems with the eyes, kidneys, nerves, and heart. It's almost like a remission of the disease, where it stays quiet, as long as you maintain healthy habits. Living well with diabetes, information and attitude. Make the difference. Whether it's type 1 or type 2, diabetes is a condition that requires ongoing attention and care. But that doesn't mean life is over. Quite the opposite. With a diagnosis comes the opportunity to get to know yourself better, adopt healthier habits, and value every achievement in controlling the disease. Regular medical follow-up with an endocrinologist, nutritionist, ophthalmologist, and other specialists is crucial to monitor health and adjust treatment whenever necessary. Technology has also been a great ally, with modern glucometers that measure blood sugar quickly and conveniently, apps that help track food intake and physical activity, and increasingly sophisticated insulin pumps. Quality information is another powerful tool. The more you know about diabetes, the more secure and confident you'll feel to take charge of your health. And that's exactly why we're here, bringing this content to you. Our goal is to provide clear, accessible, and reliable information so you can better understand your body and make more conscious choices. If you enjoyed this chat, learned something new, or know someone who needs to know more about diabetes, we have a special invitation. Yum, liked the content? Want to learn more and be part of our community? Then don't waste any time. Subscribe to our channel right now. That way, you won't miss any new videos and will stay up to date with all the health and wellness tips and information we prepare with so much care. Oh, and if this video helped you in any way, give it a like. Your thumbs up is very important to us, as it shows we're on the right track and encourages us to continue producing quality content. Do you have any questions, experiences to share, or suggestions for topics you'd like to see here? Leave your comment below. Your participation enriches our community and helps others who are also seeking information and support. We want to hear from you. And of course, if you think this content could be useful for your friends, family, or that loved one who needs some insight on the subject. Share this video on your social media. Let's spread knowledge together and help more people take better care of their health. We're counting on you in this mission. Remember, understanding diabetes is the first big step to living well with it. With information, proper treatment, and a good dose of positive attitude, it's entirely possible to have a full and happy life. Take care of yourself, stay informed, and count on us on this journey. A big hug and see you next time.